more broadly. And I want to encourage all of you, these meetings have become great resource fonts. So this meeting is going to end up on the YouTube page of the DuPage County Health Department. And I encourage you to encourage those who you want to get engaged with us to use those recordings as evidence of the good things that happen here. Encourage people to use them for education and for engagement with us. So the meeting is also being live streamed. I want you to be aware of that. And in order that we can be building relationships as we do this recording and live stream and the content of our meeting, I encourage you during the times where we're in discussion to keep your camera on as much as you're comfortable doing. But otherwise, if you're not talking, to mute yourself so that we also don't interrupt the flow of the conversation. Most of today's meeting will be of the dialogue nature. So I'm hoping that people's cameras will be on most of the time. So let me do an official welcome to everyone here. I'm Dave Roth. I'm Executive Director of DuPage Federation on Human Services Reform. And we're pleased to be a collaborator on this, the Health Equity and Access Response Team regarding DuPage County and COVID-19. Our goal for this team, which was established back in October of 2020, is optimal health and well-being for all of our neighbors, where no one is disadvantaged by race or identity. New attendees to this meeting, I want to give you a heads up. In a minute, I'm going to invite you to introduce yourselves. Share with us your name, your affiliation, and what brings you to this table. And Chris, I'm going to invite you to do that as well, although we're going to give you more of a platform later in the meeting to give a more thorough introduction.
Dave, I wonder if it might also, because we do have so many new members joining us today for the first time, maybe we could, the rest of us could very briefly also identify ourselves so you guys similarly know who else is in the room. We would like more of that time devoted to you, but maybe just briefly, at least an introduction and the name of the organization we represent.
I think that's a great idea. That's important in so many ways, Kara. This meeting also marks for us a departure, a way of thinking about the future in a more focused way. And we have a number of new members here, so I really like that idea. We'll do introductions all around in just a moment. I want to acknowledge that it has been a long time since we last came together, but there has been a lot of work in that interim period, and we're going to learn about that work today, and we're going to learn about how all of us can engage and amplify that going forward. You all have received an agenda in advance, so you understand that what we're going to do today is spend a lot of time talking about how we are going to develop our strategy for the future. What is the structure of that? We're going to spend some time celebrating ways that we've worked together in the last month. I'm going to invite everyone on the call. Here's another heads up for what's to come in the meeting. So much has changed in the last 2.5 months in terms of initiatives, closing down, reinventing, and opening up. We want to give a chance to everyone at the table today to share what's going on for you now. What's different about your work as an organization than what you had going on June the 3rd when we last gathered. Then we're going to come to a close with this meeting in an hour and a half, but another heads up, there will be a planning and strategy session regarding our new structure for planning, which is known as ARISE. That's going to happen when we close this meeting at 10 o'clock today. We'll turn off the live stream, we'll keep the recording going, and we'll go into that more detailed planning session. All right, welcome. So let's do those introductions. And I think what I'd like to do, because I can see faces on the screen, I think what I'd like to do is just ask people as I'm going across my screen, I'll call you out by name and ask you to please introduce yourself, your name, your affiliation, and what brings you here. And let us know if you're new also, or how long you've been engaged. The goal is that everybody closes this meeting feeling like you're fully engaged and a full member of this group. And that starts right now. That's going to be true of all the discussion that we have. There's no trial period where you check things out and see if you have a voice to share. That's in right now. So Kara, may I ask you to introduce?
Sure, happily. Hi, everybody. Nice to be able to say that I know most of you, but looking forward to getting to know more of you better. Kara Murphy, president of the DuPage Health Coalition. We coordinate health access for low-income, uninsured, and underinsured residents of the county. And really, it's that work and the mission of that work that brings me to this meeting. The families with whom we work were disproportionately and really tragically negatively impacted by COVID-19. And so it really was past time for us to be working as a community to figure out how to overcome those historic inequities.
Evan.
Thank you. Evan Summers, village manager for the village of Bensenville. Like Kara said, I represent, similar to what Kara does, I represent a community that was pretty heavily impacted by COVID-19. That brought me to heart, and I've been with this band of thieves for quite some time now.
Dr. Asfar.
Hey everybody, this is Saima Asfar. I am the Director of Operations of Midwest Region of ICNA Relief, ICNA Relief, and we provide various services from housing to food to mental health counseling to mobile clinic and health screenings and more. It's a national organization, and we are pretty active in DuPage County since last 8 years.
Oh, wow.
Joel Cara with DuPage Health Coalition. I work with Kara and Nathan really close, and it's truly a privilege to be part of this meeting, learning, adding value, contributing, and just coming alongside. So thank you for the opportunity.
Tyrone.
How you doing? Tyrone Johnson. Good morning to everyone. I'm with the DuPage County NAACP. I serve as the health chair. I have a wonderful group of individuals that I work with, and some of them are on our meeting, a great group of community health workers. I too am a community health worker. We participated in the Pandemic Health Navigator Grant, and that was really a great opportunity where we got to meet a lot of our community-based organizations, like Access DuPage with Kara Murphy. Thank you for all your continued support. David, thank you for inviting us to be a part of the Arise project. Our team of community health workers has had an opportunity to be briefed on the Arise project as it was being developed, as it is a part of the Illinois Public Health Association projects. So we're very happy to work on this project with you all. And when it comes to equity, the DuPage County NAACP is happy to be at the table.
Yeah. Oh, we don't quite have you yet. Hey, Thea, we'll circle. Oh, there you go. Huh, not coming through. Thea, we'll circle back to you. We'll keep going. Chris.
Yes, good morning.
Good
Chris
morning.
Chambliss here with the Nehemiah Community Project. I am the CEO and Executive Director of that, and our mission is to help people find their purpose and thrive beyond their trauma. I am a coach that is working alongside of the Federation and for the Arise project, and I'm really excited to be here and to learn more, and also to observe more as we kind of go along this journey. So thank you for having me.
Welcome, Chris. Mary.
Good morning. I'm Mary
Good
Keating.
morning.
I'm Director of Community Services for DuPage County Government. We are the social work and grants management wing of the county. I'm happy to be here.
Rafael.
Hi, I'm happy to be here. Rafael Vieira from Immigrant Solidarity DuPage. Okay, we are happy to collaborate with you guys. You are doing very good job, and we are learning, but we are doing a lot for Latino community.
Mila,
Good morning, everyone. My name is Mila Sagales. I'm with DuPage County Health Department. I've had the pleasure of working with Dave and Kara to serve as a sort of a backbone role with putting together some of our materials and helping with some of the organization of this group from the beginning and kind of see how it's evolved. So thrilled to see all these new faces this morning and have Chris here, and it's great. Thank you, Dave.
Margaret.
Good morning. My name is Margaret Childress, also with DuPage County NAACP Health Committee. And like Tyrone said, we are happy to be here and to contribute wherever we can.
Mimi.
Good morning, everybody. My name is Mimi Dahl with Condeo Consulting, and I do research and program development around health equity and health disparities. So I am happy to be part of this group and happy to meet everybody. Good morning.
Fabiola.
Good morning, everyone. My name is Fabiola Zavala. I'm the Regional Director for Advent Health, Great Lakes region that includes 2 hospitals in DuPage County, Hinsdale and Glendale Heights. My role there is to oversee our community benefit work, which includes completion of our community health needs assessments, and then also completing a implementation plan to address the needs of the community. And we know that we can't do that alone. It's great to be a part of such a great group to be able to address the needs of the community. Thank you.
Evan. Oh, I got you. So Dr. Chug.
Good morning, everyone. Rashmi Chug, and I serve as medical officer at the DuPage County Health Department. My background is I'm board certified in family medicine and practice clinically. And actually, Fabiola maintained my associate staff privileges at Hinsdale Hospital and used to be a candy striper at Glen Oaks Hospital decades ago. So lots of Advent Health connections, but really appreciate the opportunity to work with all of our partners in DuPage County. And of course, have been consumed with so many of our, internally and externally partners in responding to COVID-19, and then most recently monkeypox, and just thrilled to be working together to help address any, in identifying and addressing our health inequities to improving the health of all DuPage County residents. Thank you.
And Katie. Katie, we see your image lighting up, but we're not getting sound.
Katie, you're having a Thea moment.
Yeah. Uh-oh, poor Thea. All right, so Katie, we'll come back to you if we can get that sound to be working. And I want to invite Nathan to introduce himself.
Hi, everyone. My name is Nathan. As Kara said earlier, I'm the AmeriCorps Vista member for the DuPage Health Coalition. I just started a couple weeks ago, so I'm excited to learn more about how we can help address health equity concerns in the community. And it's a privilege to be here, so thank you.
And Jose.
Good morning. My name is Jose Vera with the Southwest Suburban Immigrant Project. We're located in Bolingbrook and serve a 2-county region. We're a community organizing agency. And SSAP exists to empower the immigrant community out in the suburbs and also build infrastructure to meet the needs of our growing immigrant populations in the suburbs. So we're excited to be part of this HEART and this equity initiative, and continue building on some state victories that we've won. I know today we're hosting a Medicaid expansion enrollment event for the immigrant community, which now can enroll in healthcare for those who are 42 years and older. And we look forward to partnering with you all on more like these events. Thank you.
Tamika.
Good morning. Good morning, everyone. My name is Tamika Booker. I am with DuPage County NAACP, and I am the co-chair for the Health Committee and newly appointed chair for the Women in the NAACP Committee. And I am here by way of the COVID-19, helping our community. Where my passion meets purpose is movement and its connection to mental health. And I'd like to focus on celebrating what's good, what's human, and what is right about our community. Good morning.
Good morning. Nicole.
Good morning, everyone. Nicole Edmonds. I am the Central Chicagoland Regional Director for Community Health for Advocate Aurora Health. So I oversee the Community Health Department for Good Sam in Downers Grove, Illinois Masonic Medical Center in Chicago, and then also Lutheran General Hospital in Park Ridge. Happy to be here. Thanks.
Michael.
How you doing this morning?
Good, welcome.
Good seeing you again. Just Mike Childress, President, DuPage County NAACP. Happy to be working with you and just listening in.
And Jan.
Hold on. I'm trying to get this together. Did it work? Good
Yes,
morning.
we can hear you.
Okay, great. I am the president of Equity and Health Advisors Network, and that's what we do. We network to build a community of health conscious, equity seeking people in the DuPage County and Chicagoland area. And I would like to say we are tirelessly working to achieve equity, except today I am extremely tired. We have a few really great projects going on right now, and I'm loving public health. Thank you.
Welcome to everyone. And as we went through these introductions, there were some microphones that didn't work, and I see folks dropping their identifying information into the chat. That's a helpful thing. I apologize for any of the sound snafus, and I'm glad that you're with us, and we'll find ways to work around that.
Dave, Gabby has also just joined us.
Gabby,
good morning,
well,
how are you? I'm so sorry, but I don't know what happened with my computer. Good morning, everybody.
Gabby, welcome. Would you introduce your organization and what brings you to this table?
Thank you. My name is Gabriela Hernandez Chico, Immigrant Solidarity DuPage. You know, in Immigrant Solidarity DuPage do have a lot of resources for my community, for Latino community. For example, we have a lot of resources for the community. We had a clinic vaccine, food pantry, any event every 2 weeks. We have a food pantry and clinic vaccine and too much things, you know.
I think we're also going to talk a little later, Gabby, and give you guys a chance to share the successes of your event last week, which I imagine you guys have to still be recovering from. Congratulations.
Thank you. Thank you, Kara.
All right, thanks all. Let me just double check before we move forward. Is there anyone that I've missed in our introductions? I've tried to do this visually from the screen. Is there anyone who's not yet introduced themselves? Oh, here we go. Page 2, Sarah.
Good morning, everybody. I'm Sarah Phelan with People Made Visible in West Chicago, and we oversee Healthy West Chicago, which supports our large network here in West Chicago, including a majority of our Latino families.
Samantha.
Hi, good morning. I'm Samantha. I'm actually the executive assistant to Mrs. Theoria Gillespie. She will be joining the meeting here shortly. She's coming into the office as we speak. We are with Quad County Urban League, which is a organization for civil and equal rights and for economic rights for our community in the Quad County area of DuPage, Kane, Kendall, and Will counties. So we help students get through their education. We help with pre-apprenticeship workshops. And we try to just do different youth builds and try to build education and further help our communities.
Welcome. And Penny, I know you're busy with our infrastructure for this meeting. Are you able to unmute and introduce yourself?
Yes. Hi, I'm Penny Chanez, and I'm the executive assistant for Karen Ayala at the DuPage County Health Department. And I serve kind of for this committee as your support for getting meeting invitations out and doing your recording and everything of your Zoom. So welcome to all of you. It's nice to see so many new faces here today. Thanks.
Thanks, Penny, and thank you all for that crucial relationship building activity. For those of you who are new to us, I hope you'll get the sense that we're interested in relationships for the long term. And I'm so appreciative that you're here, and it's really helpful to have you do this introduction and begin to get a sense of who we are, and we get a sense of who you are, and we become one. So let us now move into talking more specifically about the work that's been going on for the last couple of months to put a planning infrastructure underneath our work to give us support and clear direction. I'm going to invite to the microphone over the next few minutes Joel of the DuPage Health Coalition and Kara of the DuPage Health Coalition to help us talk through the ARISE initiative within HEART. And I'm going to begin by giving us some context about how this comes to be. You all will remember that our HEART Coalition was created in October 2020 to do our health equity work when we were so alarmed by what we were learning about the impacts of COVID-19. So this HEART group has convened an inclusive team. We've reviewed data disaggregated by race and origin. We've worked together to educate, protect, and vaccinate regarding COVID-19. And now we look ahead. How do we build on these relationships, accomplishments in what are our new circumstances, not just for the pandemic emergency, but for our community's health overall? So we seek to expand our vision, refresh our strategy, widen our network. This requires a clear strategy and infrastructure. That's what the ARISE initiative will be for us. You will remember that we presented a possible resource for this back at our June 3rd meeting. That's when we introduced the ARISE opportunity. We invited all members to engage with us in a grant application, to consider a role in the strategy building, to complete a survey that is an assessment of our equity performance. Now, our application has been accepted. We've joined a 10-month planning project that's called ARISE. And I want to talk about some qualities of ARISE. ARISE is a planning strategy. It's a partnership with the Illinois Department of Public Health and the Centers for Disease Control. They're providing the funding which is coming to us to do the work. So ARISE is also a grant that's supporting 10 months worth of activities. ARISE is also a cohort type of a project. So while we are doing our own planning work, we will also be gaining the extra benefit of working alongside other communities that are also creating plans. And we gain the benefit of a coach that's provided through the ARISE project, and that's Chris Chambliss, who introduced himself a little bit ago, and we're going to invite him to talk a little bit more a little bit down the road. So I want to say that this ARISE project is engagement with all of our members and partners. And an engagement with new members and partners we anticipate will come through the project. Over the next 10 months, we will gather data, we'll deliberate the findings, and we'll set out a new strategy for our work together. Some of the work will be done here at HEART meetings, and a lot of the work will be done in between HEART meetings through an ARISE working group. So let me let that settle for a second and just ask Does that make sense? Are there questions, concerns? How does that fit with your understanding of what we're doing with this initiative? All right. Well, and hop in anytime, but I would like to invite Joel and Kara to talk more specifically about roles, the assessment process, and what's to come.
Well, maybe let me start, and then I will very much invite you to chime in as well. I don't want to put you on the spot quite so soon. As many of you are aware, to a greater or lesser degree, we saw this opportunity come across our inboxes several months ago, and it really just felt like it was a great fit to take the work that we had already been doing as a community further, and to gain some assistance and some wisdom from other community leaders doing similar work and trying to continue to grow together. And so it really is important because there have been a lot of funding opportunities that have come about for a number of the organizations here, Pandemic Health Navigation probably being the best example, that provided direct funding for a lot of community outreach work and a lot of direct service work, helping to connect people to resources around COVID-19. And this grant really is quite different because this grant is notably spread across a number of organizations. It's also really relevant to note that we have far more partners in HEART. This is a blessing than are actually receiving any dollars from the ARISE project. In fact, as we thought about how to best spend the limited resources that were available through that ARISE funding, what we really identified was a desire to ensure that organizations that had been so directly and closely connected to COVID relief efforts and working specifically with communities that were disadvantaged through COVID-19 would have an opportunity to have some of the time that they might spend continuing to work on these coalition building activities supported with some modest funding. And modest is the right term because I don't think any of us would say that $135,000 is an insubstantial amount of money, but when you spread it across all of the organizations you see on this screen, it actually is quite modest. But I want to tell people that have been less involved in the ARISE project how we ultimately decided to allocate those resources. One of the things that we recognized that we would need for us to be able to continue to advance our equity work, and a special acknowledgement to the health department for all of the unfunded support you have provided to HEART and continue to provide to HEART, and I think will provide forever. And nonetheless, we thought that there would be benefit to having a team member who is positioned to be able to apply a portion of their time to supporting these coalition building activities. And so that's what brings me to introduce Joel, who is a colleague and partner of ours, who has worked as a community health worker like many of the other folks on this team, and also works very intentionally with us on outreach efforts to our broader community-based organization network. So we've asked Joel to spend about a third of his time for these next 10 months supporting coalition building activities at HEART, supporting making sure that we're getting all of the communications out and also receiving flow of information back. And so that's the role that he will be playing with this project on a go forward basis. Joel, I'll pause there and just ask if perhaps you want to add anything in terms of your work or your interest in this kinds of efforts.
Yeah, fantastic, Kara. Thank you for the introduction. It almost feels like you present me better than I could. So thank you. But it's truly a privilege to come alongside here. I know many of you. We had rubbed shoulders in the community, built a lot of good things in the community. And I'm very thrilled and excited to know a like group with the same heart, with the same focus to build incredible opportunities, incredible initiatives to better our community and just continue strengthening our relationships. I would say a couple of things. I'm very relational guy. Trust is huge. And I think a lot of what we do here together is build on trust and building common understanding with the same aim. How do we enhance and amplify our services together? So for me, it's a true privilege to work alongside you, to connect with you. So you will be seeing me more, getting communication from me, and again, more important, I'm here to serve and come alongside. So thank you, Kara, for this opportunity, and looking forward to strengthen and develop further what we do together.
Thanks, Joel. The other things that I will say that the way that the ARISE project is structured, it actually establishes that 35,000 of that 135,000 will go directly to the health department to support many of those COVID relief and coalition building activities that we've described. That's far less than they're actually investing in that effort, but nonetheless an intentional structure of the ARISE project. And then in addition to that portion of Joel's time and the portion of health department time and resources, we thought about how best to invest the remainder of the resources available. And so we have elected to put aside a modest portion of the funding to support interpretation and translation as we as an organization think about what activities we may wish to embark upon in the next 10 months. We wanted to have some resources to ensure that any communications we were putting together could be accessible to everyone within the community. So that resource exists. We also have some dollars set aside for focus group activities. So if we decide that we really need to go deep and look closer at some unanswered questions at a community health equity level, we have some resources to support that. And we also have some resources to support incentives for those individuals that might choose to participate in those focus groups. And then the remaining dollars in a relatively even allocation of about $10,000 per organization are being applied to a number of agencies that have been very invested in this project since its beginning, but also have been very invested in direct service, community outreach, and engagement around COVID-19. Many of the organizations that are named and funded within the application are organizations that were and are working in that community health worker space. So grateful to have NAACP and ICNA Relief and SSIP and Jan Geider and her work, and to be able to be modestly supported. But again, recognizing that this is really helping to support the time that you all are spending with us on this effort. We are all working to and must continue to work to find additional resources to actually support that direct outreach and service work. This grant is not large enough to cover that. Nonetheless, it's a really helpful step forward in terms of creating additional structure and support for HEART to ensure that HEART has a life and energy and vision that goes beyond the most immediate needs of the pandemic to look at health equity in a broader way. I want to pivot to talk for a moment, if I could, about the ACT assessment, which many of the organizations on this call participated in. And I want to say thank you. Chris could probably say better than I, because I imagine he was involved in the back end part of this process. But to have 15 organizations participate in that assessment and to be able to give us that feedback, honestly, that's worth the price of admission, because it's been, what I anticipate, one of the things that we'll be doing in the course of the next year is really looking at and continuing to evaluate the degree to which our community coalition building is having a consequence, both in terms of the health and safety of the community, but also in terms of the ways that we engage with one another. And I can pull it up if there's no one else that's able to do so, but I'm wondering if one of the other folks on the call has the ability to share the ACT assessment as a PDF. Mila, do you have it accessible?
I don't have it up. Hang on.
Okay.
But yeah, start talking and I'll get there.
No, we didn't actually script that part out. We didn't figure out how we're going to do that. So apologies, guys. I'm not going to, I think we've sent it to everyone by email yesterday. So if you hadn't seen the results of the community-wide ACT assessment, I would encourage you to take some time to look at it, because it's fascinating. And I imagine that we will test at least an additional time at the end of this grant term to see whether or not the evaluations that we would each as partners provide will change or shift over time. One of the things that I really appreciated in looking at the results of that data, of that assessment, was that there was not a homogeneous response, that even though we've been working together and often work together in other rooms besides this one, where you stand on that assessment probably depends on where you sit, and vice versa. And so what you could really see was that there was a tremendous variety of responses. Some people that would assess the maturation of this coalition at a very high level, others that thought that we were really at a much earlier stage, and then a whole lot of people that were somewhere in between. And there is no right or wrong to that. That is just literally where we are today. And what will be interesting is to see, as we continue to work more closely together, whether we find that there's more consensus that is gained or a shared vision of where we sit, and also whether we see improvement or growth in certain places. So if you could just scroll down here, maybe we'll stop here a little bit at that one, if you could. Thank you, Mila. I'm not an expert enough on the ACT assessment to try to give anyone a statistical analysis of what we're seeing here, but what you can see is that they were measuring on different segments or different, they defined the terms of communication and plan for action and measure to improve, and then had multiple questions in most cases that assessed where we were as an organization on those different scales. And what you can see is that there are some places where collectively in aggregate, our responses would suggest that we're somewhere in the middle or top third of our own expectations for ourselves in terms of capacity, and other places where we have a lot of room to do some more work together. Let me have you scroll up a little bit more, and maybe we'll just look at one or two of the questions to give a sense of the variety of answers that came about. Here's a great one, actually. So this was a question that asked about the degree to which we're working with partners from different sectors. And you can see that there are answers literally all over the map. It would in fact be hard to tell you what the dominant answer was. There are a decent number of folks that are probably giving us a C or a B if you want to assign a value to that. But equally, there are plenty of individuals that would say that we have substantially more work to do to achieve success in that area, and a few people that think that we are there. Let's move and do a few more. That was strength with collaboration, but let's go a little further. That's a good one. Let's see here. Develop leadership and decision-making guides. Again, you're seeing something very similar with a poll that's probably on this question a little bit lower, suggesting that we're sort of in the building phase. But nonetheless, you still see answers that are literally, running almost the entire gamut of the potential options. And I think that it will be interesting as a group to explore how and why people have made the decisions that they have. But not to challenge that, more to provide the context that we all need to understand how the experience of coalition building is from the different perspectives at which we all sit. So I'm not going to spend too much more time on this because I think that the theme actually runs all the way through. But what we will probably look at as a group is places where our aggregate scores are lower, and perhaps focus some additional energy and attention on thinking about and working with Chris what we can do as a group to grow our capacity in those particular areas. Jan, I see your hand raised. Please, by all means.
Kara, as I was looking over that report, my question, and I think you said something that is so crucial. It depends on where you're sitting in this process. Yeah. And I think, and I'm going to go back to that wonderful Impact DuPage study, that even though DuPage County has been noted as the healthiest county in Illinois, we still have such disproportionate health outcomes by race, and particularly with our Black and Brown people. So my seat is a little bit different, but I think we're on the same stage, and that's important. But I would like to just kind of get some feedback from David when he looked at that report, and not to put David on the spot, but again, you know, because we are looking at this from different perspectives, David, what did you think as you were reading that report?
My first reaction was like Kara's, that what we have an opportunity to do here is make decisions together about what's most important when we will see many disparate opinions about what's most important. So it's the candor. That's the first thing that hits me, the candor. What a great way to start a planning process with kind of a sober, clear look at how our equity work thus far has been viewed. So I'm not ready to put my oar in the water about what's the one I think we should go on. I'm ecstatic about the idea that we're looking at these together and we'll make those decisions together. My own sense, Jan, is that so often when we do a survey and we put it in front of us and the themes that we see that are there, once we start talking them through, new pictures emerge. So I'm looking forward to what are those things that are going to emerge when we have our conversations about these individual responses. So I hope that's not too wimpy of a response, but that's my thought.
David, it's an honest response, and I certainly appreciate that. And Kara, as we go forward, the one thing I'm going to ask of everyone here is that we begin to look at the importance of health education, health literacy. One of the things I've observed, and even visually as well as from various studies, is so often because that gap is around the health literacy in our community. I should say health illiteracy. So I'm hoping as we look at setting aside funds for translation, that we also look at setting aside funds or part of those funds will include improving the health literacy of our community. Thank you.
Thank you for that, Jan. And Mila, I see your hand raised, so let me respond to that very quickly, but then I'll turn it over to you. I think that you're right that we have a lot of opportunity to look at questions of health literacy and health education. There may be a little bit of funding that's available through this to support that, but I think what we might also be able to think about is how to apply our time in service of finding more robust funds that would support that effort in the community, because I have a feeling that we would need an investment greater than we will have access to through these dollars to be able to make a meaningful impact. That could, however, be one of the places where we as a group focus our work. Mila, to your comment.
Oh, thank you, Kara. I think, Jan, you started right where I kind of was thinking when we first started talking about this grant, is that, you know, DuPage County has been recognized not just this past time, but in previous assessments as being the healthiest county. And we're really proud of that, but we know, and we saw through all of our Impact DuPage assessments that health equity came out in every single one. So whether it was an individual, organization, or the data, it came through as a priority. And this opportunity to really look intentionally at where people are and how they feel about it and their connection to the work is something that has been focused on COVID. And now we have this opportunity to go deeper than that. And it's really a critical time for us. So the assessment, the only other thing I wanted to add about the assessment is that it's our foundational start, and we can reassess and see and measure, which is one of our intentions from the beginning, not only for health outcomes, but for this group too, as we still grow.
We're going to have a chance to talk more, and certainly I really, again, want to invite anyone who's available to join us for the second portion of this meeting. We recognize that that was an invitation that came later. Others may have commitments, but it will be our opportunity to talk more with Chris and learn a bit more about the vision of the ARISE leadership group outside of DuPage County about how we can use these resources most effectively. But I do want to make sure that I, when I talk about the funds from Arise, mention one more component that's going to be relevant to our planning. We're going to talk more, I think, about reporting and some of the pieces that DuPage Health Coalition will try to take the lead to ease for the rest of our partners, but we'll very much need feedback from all of you to be able to be successful in reporting the outcomes of this project to the Arise team. But there's also another component that could be very rich as a resource for us. There's funding that's in the grant for some travel, and there's an expectation as partners in this project that we will send delegates of this group to participate in 3 meetings across the course of the next 10 months across Illinois that will bring the different cohorts. I think there are 15 cohorts. Chris, is that 15 cohorts that received full funding, and then a smaller number of cohorts that received more modest micro grants. But they will be bringing those folks together in 3 different locations throughout state of Illinois to be able to have 2-day workshops and planning events. And so we think that probably what will make sense will be to have 1 or 2 members of HEART that would continuously try to participate in all of those events. But then we would like to cast as wide a net as we possibly can to bring all of the different partners that are participating in HEART to participate in those conversations as well. I'm hoping that at least one of them is local, which would certainly ease the path for individuals that wanted to participate, but perhaps did not have the means to be traveling for 2 days to do so. But we do know that the first event is being scheduled for the end of September. It's either going to be the 28th and 29th of September or the 29th and 30th. It sounds like there's a conflict on the 30th that has them revisiting the timeline. And it's going to be in Springfield. So that first event is going to involve travel. Any of the folks that join us for the latter half of this meeting, we can talk more about that. But separately, we may also be reaching out to you to explore your interest after the meeting as well. I think that although there's a lot more that we could talk about, maybe we should pause there and just acknowledge that this is a unfolding opportunity, but one we're really excited about.
Thank you, Kara and Joel, for that overview of roles within the Arise project. And so to reiterate, our HEART meeting this morning is going to extend until 10 o'clock. At 10 o'clock, we'll turn off the live stream for the HEART meeting, and we will enter into a second meeting, which is an Arise nitty-gritty work group meeting. And all are welcome for that next step. I also wanted to take a moment to invite Mila to talk about an incredibly important element of our collaboration here, and that's our data partner, Impact DuPage. I neglected to give this a good view when I set this original context. Data is so important to our life. We learned from Jan that if we look at the big picture only with data, we don't see what's really going on when we disaggregate. And our partner in that work is Impact DuPage. And Mila, could you talk about that and its equity role?
Yes, thanks, Dave. And we alluded to it a little bit earlier with those assessments that the county recently did, and Jan is throwing some kudos in the chat about having the access to that data. So for those of you that haven't looked at it, Impact DuPage is a unique way of looking at our population health data and being able to search it by zip code and age and ethnicity and take a look at the health outcomes that we're working on. But as we go through our assessment as a county every 3 years, this past group of assessments put us in the place, and I know Nicole Edmonds is on, so I invite her to share the hospital angle of this too. But DuPage County uniquely collaborates on this project and make sure that we reach wide on the data collection. And even though we know we have a good handle on what that data collection is and health equity rose in each of those assessments from the community and the hospitals, and Debbie is on here too. So it is unique to have that data available to us, but health equity came out as a cross-cutting goal across the 2 health priorities, which are prevention and management of serious illness, and then the awareness and prevention and treatment of substance use and mental health. So we haven't, as a group, been able to step away from COVID yet to get into those areas, but this is a great opportunity for Arise to help us. And we've already started with that first assessment that we just looked at. So it's really a nice connection to Impact DuPage. It's going to help us measure, but what is glaringly obvious, like even from the beginning of this, was that we didn't have data collected on our MENA residents. And so we looked as we were going through COVID and said, this is a huge gap. We don't have it. We don't even have a strong means to collect it yet. We have some folks advocating for that data collection, but there's just a lot of work to be done in that area. And I wanted to bring Impact DuPage into the conversation because we are going to be measuring our work in health equity. And so hopefully at the end of these 3 years, we're going to have some outcomes we can look back on, not only as a coalition, but at this health outcome level with all of our partners. And Fabi and Nicole and Dr. Asfar, please join into that if you have anything to add, because it is one of those data collection points that we touched on for the last year, but we certainly haven't been able to give it the attention that we need to.
Thank you, Mila. It's just exciting to start that journey, and we are looking forward to that. Thank you.
Eve, could you just share what you and Tim have been working on in terms of trying to understand who is collecting what information in regards to our Middle Eastern and North African neighbors?
Sure. Let me, I had thought to do this in the reporting in later, but let me give like the 2-minute overview of this. It was more than a year ago at this table that Dr. Asfar challenged us to identify the impact of COVID-19 on immigrants coming from the countries of the Middle East and North Africa. We were looking at data disaggregated, and there was no way to discern where our immigrant neighbors from those regions were fitting. So we know now we want a data collection system for bringing optimal health that is a partnership between the community, the data collectors, and the planners like us. So a work group developed. We sought out relationships and strategies from other groups that had tackled this issue of identity for immigrants from the Middle Eastern and North African countries. We put together some recommendations. Now we're going deeper to look to do a specific recommendation for identity categories in data collection that will be usable by healthcare partners in DuPage County and the state of Illinois. Tim Ackerman is a master's level public health student at Northern Illinois University. He's staffing this for us. The project will determine what identity community members prefer to use in being identified and the categories that they will be responsive to in data collection. The project will determine what categories are currently being used by healthcare providers. And ultimately, we're going to bring those two things together to come up with a specific recommendation that addresses the community's own sense of itself and wishes and identification and the way that health systems collect it and that planners use it. So thank you, ICNA Relief. Your staff have been incredibly helpful to us in looking at the survey instrument, which is almost complete. And I want to do an invitation to all of the members of this group. If you serve immigrant neighbors from the countries of the Middle East and North Africa, we would love to partner with you to distribute this survey. We also will move from the survey into a focus group that will take the survey results and have some discussion about what do we think this means. Thank you, DuPage Health Coalition. You initiated an inquiry, a request to our healthcare partners in the county to share their information about what are the categories they're using. And I want to do an invitation to all the healthcare providers at this table. Please do help us out there. Send us your means, the way in which you categorize currently. And we promise to work with you to give you some good ideas about what the community would like to see included in your data collection categories. We're at the place where we got the survey almost done. We're underway in collecting the information from healthcare providers. We hope to bring this to a close by the November meeting of this group. So we hope to bring back to you recommendations at that time. All right, thanks. Any other questions, concerns, comments about the structure of ARISE or what's to come?
David.
Dr. Asfa.
So David, can you share more on the survey? Perhaps an email, like what are the questions and how you are conducting the survey?
Sure. So where we're at now is that we're having individual conversations. And in fact, we just finished a fantastic conversation with Hulud, Dr. Asfar, and she upended some of the thoughts that we have. So we're revising the new draft is going to be ready early next week, and we're going to bring it back to her and to some other advisors. So it's in the process of refinement now. As all of you might guess, there's an incredible emotional undertone in asking questions about identity. And it's really, really helpful to have input from the community about how to approach this. What are the most important issues, and how do we talk about this in a way that's respectful and honors people's feelings? All right. Well, if there are no other questions about that, our ARISE planning project, let's take a moment to say thank you and acknowledge some good work in community building and trust building. I'm bringing attention to the Monarch Butterfly Festival that took place last Friday evening. I want to say thank you to the event organizers, Immigrant Solidarity DuPage, and I want to give a big thanks to Heart Partners who engaged with that event, and that's World Relief, that's DuPage Health Coalition, that's the DuPage County Health Department, and it is also NAACP DuPage. All of you engaged in that event, and a special thanks. Some of the folks are on the call today, some are not, but I want to say to Isabel Huerta, Sylvia Soler, Charita Balarsik, Maricela Ibarra, and Mohammed Mahmoud. Thank you so much for coming out and spending time at that booth and promoting health and health equity through the festival. So I invite our friends at Immigrant Solidarity DuPage or any of the other partnering organizations to share your experience of that event.
Okay, I am Rafael Vieira. Yes, we are proud this event was successful, was a big exit for us. We are waiting for 2 years for do one more time this event because the COVID we don't did the last 2 years, but this event we are doing Eagle 6 years. We are doing, and we are growing, and the truth is was very, very, very nice be there, and very nice be you guys was there. I don't know, I enjoy. Michael Childress take a very good pictures, and I would like show sometime that pictures what was the event, but thanks for coming.
It's an incredible power that you have to bring the community together and to have folks of all ages. They can combine having a good time building relationships and learning. And I so appreciate that work. And I see, Michael, I see you raising your hand. Are you wanting to speak too?
No, I was just waving to Raphael.
Okay.
Okay.
David, let me tell something. I think so, Rafael, and David, and everybody. I think so. Maybe we have around 3,000 people, right? Around. It's a lot of people. You know, this is a beautiful event because we have a lot of hours with the community and enjoy. You know, we have the very important information for our community, and all people, families are really, really happy in this event. And I hope we hope that the next year we come back with the Monarch Festival Butterfly.
Very good.
Yeah.
And thank you
It's
for all that
important.
work.
Yeah, sorry. It's important to say we get around 30, 40 voluntaries. Anybody, all these guys was wearing the best immigrants, right? The best are voluntaries and all be there helping all day. We start since 3 p.m. until 11:30 p.m.
I will say I was at the Immigrant Solidarity, and I committed to Raphael and his organization that next year the NAACP will have a booth right next to the Heart booth also.
Yeah.
All right, thanks so much. It's nice to experience the event, and it's nice to be able to celebrate it. What I'd like to do now is make a shift, and I want to change everybody's mind frame to be thinking about now making a contribution into this conversation. And here's the context. Last spring, we knew that a number of new funding opportunities were arising due to the economy, due to COVID-19, due to other circumstances. And it was important that we get engaged in those opportunities in a planful way. And so all of this group was invited to a community conversation hosted by DuPage Federation that featured 6 key funding sources that were on the horizon. Many of those sources now have come to fruition. Application processes have gone through and projects are underway. So there are some new projects underway. Some of those funding opportunities are still in deliberation circumstances. But what I'd like to do here is invite everybody on the call, and just about everybody here has some role in one of these along the way, as a funder, as a doer, as a planner. I just want to encourage you to share what's different today than what we knew 3 or 4 months ago when this wave of opportunities came our way. And a couple thoughts come to my mind. Jose, you mentioned earlier the expansion of the health benefit and a promotion and event regarding that. And so you're one person I know I want to encourage to let us know what's going on, what's different today. And I would encourage everybody else to be thinking about that too. Could I invite you, Jose?
For sure. Yeah. So one of the things I want to mention is that that I know, we were part of that initial conversation, and actually this week we attended an award ceremony where we were able to receive some funding from the Edward Elmhurst Community Investment Fund to expand our work around health justice, and we're going to be able to do that work alongside. I think it was Kara with DuPage Health Coalition was there, which I finally got to meet in person. We have met in a lot of Zoom meetings with many of you all. But yeah, it's just exciting just to see the, how we went from the idea phase to like actually, now receiving an award and actually the implementation phase. But one of the things that we are we are seeing a big increase on calls, and maybe many of you as well, is this expansion on Medicaid eligibility, which is now open also for the immigrant community, regardless of immigration status, anyone over the age of 42. And what we came to see is that there was a lot of folks who were wanting to apply for this, but they wanted to do it with a community organization they trusted, and they didn't necessarily wanted to go with just anyone. Like I saw a lot of flyers on social media just saying like, just call this, ACA enroller and they'll be able to help you out. But many folks in our community were not necessarily so trusting, and they're like, yeah, not so sure. So what it really taught us, I think, is just making sure that we have those trusted messengers, right? And then also making sure that as we're expanding these programs, there's actually an implementation plan, and just making sure that our communities have access to these resources. So all that being said, we're hosting an event today, an enrollment event in Romeoville, and then we also have one already planned in next month in September in Bolingbrook. And we have folks who are going to be assisting to enroll folks right there on the spot with using the ABE website and making sure that folks get access to this resource. So we're looking forward to that. We're expecting a really big turnout for today and then also for the month of September. And then we're also looking forward to partnering with maybe some of you all to do something in the Woodridge, Lisle area, because we know we have a lot of clients in that area that often get left out, from many of the different services. So want to make sure we target them as well. But yeah, thank you.
Thank you. And I see that Kara, you've noted also ways in which you're paying attention to this expanded health benefit for immigrants who do not have that resident status. I wonder if this is a good time to maybe just poll people around the room. Who else is doing that? Who would like to learn from what Jose and the Southwest Suburban Immigrant Project are doing and accomplishing, and what Kara is doing and accomplishing through Access DuPage? Other folks, are you engaging in this benefit? Or so what do you have that you'd like to share, or would you like some help with that? And what is it that you need?
I'll just say that I know that Casa Michoacan is also similarly doing some special events intending to bring people in to be able to have support completing those applications. I know they're not on the call.
All right, very good. It's a really key one. And I want to say that our job at DuPage Federation is training regarding that benefits eligibility, and we will be doing that with vigor this fall. We'll be working with community partners to identify what's the gap that we can help fill in. And Mila's noting in the chat that the health department also is on board and providing opportunities. So thank you, Jose, very much for opening that one up. Now I want to invite, I don't have a finger to point to anyone on the call. I just want to encourage you what is happening. I do see Kara's pointing finger getting ready. So there it is.
To Tamika.
Okay.
She's got her hand raised.
Thank you. Tamika.
Good morning again. I just wanted to piggyback off of the Medicaid enrollment, and I'm very interested in, and we did do a training with DuPage Federation. I think it was October or November of last year. I know there's a lot of updates. I'm very interested in that and how to be a part of a funding opportunity to do that within our community to make an impact.
I can't resist tagging onto that, Tamika. As the COVID-19 public health emergency comes to change in public policy, and as the public health emergency ends, we know that the state of Illinois will be doing Medicaid redeterminations. And we know there's a huge risk in that our constituents who are most at risk will inadvertently lose coverage. And the best antidote to that is for them to keep their address up to date with the state of Illinois. And we have some instructions on our website, our homepage, dupagefederation.org, but you'll find them in many places. Really important to be encouraging your constituents to keep their Medicaid addresses and contact information up to date with the state of Illinois.
Mary, I wonder if I could put you on the spot and invite you to share updates. The county has been so busy on a series of grant opportunities, and I wonder if you could just share with people where you are in all that process.
Sure, I'd be happy to. So since the last time we got together, we announced the grant awards for the immediate intervention grants. That just a reminder, the county provided $10 million to the DuPage Foundation to provide grants over a 3 to 4 year period in the areas of food insecurity, housing instability, mental health, and substance use disorder. So the way DuPage Foundation approached it was they did what they called immediate intervention grants as sort of the first phase, meaning organizations or grant opportunities that could get funding out into the community as quickly as possible. So we announced those awards back in June. About 25% of the money went for food assistance, about another 25% went for housing services, and then about 50% of the funding went towards mental health and substance use. It was about 1.1 million in grants that were provided. And then the second phase is what we're calling the transformational grants. And those were opportunities for organizations to really think on a larger scale, think more about how they could potentially transform their service delivery systems, their organizational capacity. So the letters of intent for that opportunity were due, I want to say in June. And there have been, let's see, I'm pulling up these numbers here. 20 agencies were invited to submit a full application for that opportunity for a total of about $4.7 million. So we're really excited about, number one, having gotten the first phase of grants out the door, and now secondly, looking at these opportunities, like I said, to really transform programs and services so that we're better connecting to the community. Thanks, Kara.
Thank you very much. If folks wouldn't mind, I want to chime in with a few things, but I want to lead with a huge thank you and also an acknowledgement of the power of partnership. As everyone is aware, we have overall very strong rates of vaccination here in DuPage County, but lagging rates of boosters and lower rates of early childhood vaccination than we would wish for. And so both of those are areas of focus, and in support of that, and also recognizing that many of the families with whom we work are struggling to make ends meet under our times of inflation and gas prices and everything else, we elected to do some fundraising to fundraise for gift cards that would go toward back to school supplies for our members and others that would come to our upcoming vaccine events. And we posted that on social media, and Jan Geider took that as a personal charge. And when I tell you that of the 30 people that donated collectively more than $3,000 to allow us to provide an additional 150 gift cards for children, I think at least half of them were related to Jan. I am not even kidding. And I just want to really say thank you so much, Jan, for your efforts and your advocacy and what a difference it will make. We will be able to include those gift cards in probably our next 4 or 5 vaccine events, which is huge and incredibly helpful. We had an event a few weeks ago that had 34 attendees, I believe, and 26 of them were kiddos that got those gift cards. And so I know that it makes a difference for the families. One mom with 4 kids came in and having $80 to be able to spend at Target toward those kids' supplies was a meaningful thing for her. So thank you, thank you, thank you. The other thing I'll say is that the health department is again,
Kara, that was my pleasure. It was a fun time for me, and remembering training I received years ago, and I'm going to date myself, but by Lee Phillips, who used to head up what was the old Crusade of Mercy. I sat down with a cup of coffee and just started texting people. And quite honestly, only 4 or 5 of them were relatives, but everyone else were friends of mine, mostly here in DuPage County. There were a couple of doctors, I'm sure you noticed, from Edward Hospital. And once I put the word out, they start sharing, and it just snowballed. But we had fun, and it was
force of nature.
Yes.
Force of nature, Dan.
Okay, well, thank you for that opportunity.
The other thing I want to mention, because I think it has relevance for the folks on this call, is that the Health Coalition for the third year will be launching our flu vaccine initiative in the coming weeks. And this is an opportunity for individuals who are uninsured to be able to get a voucher to be redeemed at any of the Jewels in the community for a free flu vaccine. Similarly, Hamdard and VNA also participate and provide vaccinations at their locations as a part of this project. So we in early September will be in a position to, of course, share those vouchers with all of our Access DuPage members. But for our community partners on this call, if you are in a position to be able to screen individuals to find out those who don't have insurance and live in DuPage County and provide vouchers through your efforts, we would be happy to share some vouchers with you to be able, and would really frankly appreciate your help on making sure that they go to the families that need them. So you can send me an email. I'll put my email in the chat. Actually, I'm going to put Joel's email in the chat and see if, because Joel will likely be leading up a lot of that distribution to community-based organizations. Please reach out to us. We would be happy to help make sure you get some for your own use.
Thanks, Kara. We are at about 10 minutes till 10, and I'm realizing as we're making our way to the close of this meeting that I didn't keep my earlier promise to Chris Chambliss regarding a more thorough introduction regarding role with the ARISE project. And Chris, I want to invite you. So we're now at a point of transition. We're going to be closing the HEART meeting. And we're going to be moving toward the ARISE meeting. We're still in the HEART meeting. We're still live streaming. And I wonder if you would like to take a minute. You now could reflect a little bit on what you've heard about our perspective on what ARISE can do for us and with us. Would you be willing to give a little bit more insight into the project and your role?
Well, thank you, David. Yes, so I learned years ago, my father is now retired, but he was a pastor, and he always said, when you have something to say, get up and say it and be short and sit down. And so due to time, I want to be respectful of everyone's time and to acknowledge and have more time to talk at the after session or at the 10 o'clock hour. But ARISE is such a great opportunity, not only for myself, to be able to learn and to understand and to partner with those that are actually doing things in the community, those that are the high low and those that are boots on the ground. I think this kind of encapsulates everything that we're about, and that's community. And ARISE within itself, that's embedded in the name of it, is relationship. And that speaks to me very, very deeply, because before I do anything, it's relational based. Right? Before I go anywhere, it's relational based. And so I think as we kind of move throughout this project, and I, as a coach, walking alongside of everyone that I've heard today, it's just really, my heart was just really full to kind of really know and see the contributions that everyone is making to their respective communities, and even those personal communities that we have. And so I think the tools that ARISE have are great and that are excellent, that'll kind of help us to kind of see where we are, and then we can forecast where we want to go from here. So David, thank you for this time. Those that have allowed me to speak. Kara, thank you so much. I really appreciate it. And then I'll just leave it there. Thank you.
Thanks, Chris. So we welcome you, and to those who've come on the call since the beginning, Chris Chambliss is the leader of the Nehemiah Project, and he is working with us as a coach for our ARISE planning process. And we're so grateful, Chris, that you're with us. So now I have us at 9:50. It's about 10 minutes till 10. And an unusual event has occurred. We've come to the close of a HEART meeting without trying to jam a whole lot of more things in at the close. And I'm going to recommend that we do this. We will begin the ARISE work group meeting at 10 o'clock. So we now have a 9-minute break period where we can turn off the live stream